Welcome to Daytime Ottawa here on Rogers TV. I'm your host, Derek Fage, and you may be surprised to know that flu season has moved into its third month. And although numbers probably typically look fairly low at this time of year for us, it's always important to get your flu shot. Here to tell us why is Dr. Paul. He is the Medical Officer of Health of the Eastern Ontario Health Unit. Dr. Paul, welcome to the show. Great to have you here.
Nice to be here.
We've been talking so much about vaccines when it comes to COVID-19, and I think some people, certainly when it comes to the flu shot, they may think that perhaps they don't need the flu shot this year. With all the information out there, it's hard to really understand what's going on sometimes, but it's still important and probably more important than ever, isn't it, Dr. Paul?
Yes, it is. Last year we got away with it, and we weren't sure what was going to happen. We thought that because everybody was taking these pandemic precautions, that we were able to offset a lot of the respiratory viruses, which we did last year. However, this year is a different picture. We've been vaccinating more and more for COVID. We're opening up more. Things are much less restricted than they were last year. We saw Australia didn't have a flu season. However, we're now seeing, as of August, September, other respiratory illnesses, RSV viruses or viruses that cause a common cold circulating. So they circulate and spread just like the flu does. So we don't have any reason to believe this time that we won't have a flu season. So we do think there will be a flu season. Hopefully it won't be as severe, but it really is important that people don't want to get flu and COVID obviously at the same time, and the flu actually mimics COVID symptoms. So it's going to overload our healthcare system as well if a lot of people get the flu and have to go to the hospital and so on. So for all those good reasons, we're recommending that people should get their flu shot, even if they've gotten their COVID-19 vaccine, no problem, and they can get it at the same time right now. So it's a 2-for-1.
Yeah, I was going to ask you about that. So there's no problem if you go in and you get both at the same time, and I imagine that also includes the booster shot, correct?
That's right. The COVID-19 vaccines, the ones that we have right now, currently can be co-administered at the same time if it's your first, second, or third dose.
Do we expect more Canadians to get their flu vaccine this year? What are you hearing?
I'm hearing that particularly the elderly are rushing to get vaccinated. We know that it's always a bit of a struggle in the younger age groups. We highly recommend it, particularly at the different spectrums of ages. So for sure the elderly and for sure younger children, but a lot of people in between, particularly if they have medical conditions. And it's also important to get vaccinated. In Ontario, we're lucky; it's universally free for all ages, and so it's a good idea to get vaccinated. And yes, we have a bit of a increase uptake of the flu vaccine this year, but it's particularly in the older individuals. So the younger individuals should, if they're thinking about it, they should get vaccinated.
How are we doing, Dr. Paul, when it comes to COVID-19 vaccinations? We've done quite well here in Ottawa, but when it comes to the region that you look after, what do our numbers look like at the moment?
We're doing extremely well. We're actually close to 92% of first dose and 88.5% of second dose in our area of 12 plus, which is great. We have some pockets that are lower, some in Cornwall, for example, and in Hawkesbury, we had some lower numbers, but we're working hard with those populations to vaccinate them. And as we're getting those vaccination rates up, their numbers of COVID are going down. So we're going in the right direction, both in terms of cases and in terms of vaccination. So we're not far from that 90% second dose to 12 plus age group.
There's a lot of different reasons that people are, have this, vaccine hesitancy. And, I'm not talking about the anti-vaccination, the anti-vaxxers as they're called. When it comes to those that are hesitant, what sort of communities are still a little bit hesitant when it comes to getting the vaccine?
Well, it's not more of hesitancy. It's more that they have a lot of things that get in the way. Let's put it this way.
Okay.
So it's more the communities that are that have difficulty going, for transportation, for example, more rural, isolated communities, socially isolated communities, and so we're trying to remove those barriers. Yes, there's going to be the strict anti-vaxxers that won't want to get vaccinated, but there are a significant amount of people that are not just not able to get vaccinated, have so many social things that are in the way, family disputes, poverty, food instability, those type of things. And so we're working a lot with our partners, social service agencies, municipalities, to actually remove those barriers. And we bring it to them. We bring it closer to them. We have walk-in clinics, and they're working very well in Cornwall. Over the weekend, we had a walk-in clinic in the Cornwall area alone, where over 270 people just walked in and got their doses, many of which were first doses, which is great.
Beyond the vaccine, Dr. Paul, those of us that have, like myself, we've gotten both of our vaccinations. What other ways can we protect ourselves for flu season and against COVID-19?
Well, the good news is that what you do prevents you from both. So, obviously, not going out when you're sick, staying home, making sure that you wash your hands, you wear a mask. It's very important. Masks are still important. Don't forget they're not only going to prevent you from spreading COVID or getting COVID, they're also prevent you from getting the flu. And so those are the type of things, all the usual public health precautions: disinfection, washing your hands, not going out when you're sick, not going to work when you're sick, and so on. Those are the same things in addition to the vaccinations.
Any
And those
concern?
work for not only the flu, but they also work for the cold as well, common
Right.
colds as well.
Any concern, the holiday season, people are going to start getting back together, feeling a little bit of normalcy. What do you recommend for the holiday season?
Well, we recommend the same approach. And importantly, if you can get together with vaccinated people, mixing vaccinated and non-vaccinated people is not a good idea. However, if you're going to do so, make sure that you all are wearing masks. Individuals that are vaccinated and getting together with small gatherings. I know that we have limits of 25 indoor, but keep it small. And if you're all comfortable and all vaccinated, you don't have to wear masks.
Terrific.
However, if you're not, you do. You all need to.
Thank you so much, Dr. Paul. Always a pleasure. We'll be back with more Daytime right after this.